to kind of teach them in this skill of how to safely inject and how to do it kind of the proper technique way. And then in that same conversation, Jess was also on there talking about her experience as a nurse and having experience in phlebotomy and all of that. And so we have decided to collaborate together to kind of host this workshop about techniques, that have worked for us in the field and for me personally, and kind of go from there. And just disclaimer, I'm a person in recovery. I'm a former IV user, but I love and support people who use drugs. And so, this is what worked for me and it's what works for many of my participants, but I also want to encourage discussion. Oh, Albie says captions. Jesse, you know how to do that? Mm-hmm. Okay, cool. So yeah, I want to encourage discussion and education, because one thing about harm reduction, we do it all together. We're better as a team when we work cohesively together. So any feedback or questions or, sharing of, well, this is what worked for me, or this is a tip that worked for my participant, that's definitely encouraged. And we are going to work to share a Google Drive folder that has some handouts and stuff in there, along with a kind of sheet about the outline of the presentation today. And we'll have another one that's kind of a rough draft that'll be open to everybody. So if they want to jump in there and say, hey, this trick really worked for me, or anything like that. So that's just kind of the disclaimer. And then the other thing is just, I want to just say content warning, trigger warning. We'll be using like a dummy arm that has actually has sugar-free Powerade in it to simulate blood. There will be syringes and tourniquets and drug paraphernalia and stuff like that. So just, if you're queasy or, you're in recovery, just content warning for that, just to be sensitive. So with that, I'm going to pass the baton to Jessie so she can do a little introduction as well.
I am thinking that unless Kate Dunn or somebody else who's a lot smarter than I am, that it's not wanting to do the closed captioning while we're recording at the same time, which is odd. Somebody help, because I'm not the smartest one in the room by a long shot. Is that a good introduction? No.
Perfect.
No, I'm Jessie B. I'm down here in Southwest Georgia, and I'm with Never Use Alone and the Georgia Overdose Prevention and 229 Safer Living Access. And we just, there's been a lot of questions asked, and I think when we start talking about injection drug use, I mean, everybody that's ever been an injection drug user has got their way, what works for them, what doesn't work for them. Anecdotal evidence or beliefs that they'll defend to the death. So we just kind of come together, listen to some things that people have asked for, some things that people have talked about, and like Rachel said, this is just going to be down and dirty 101, just to really kind of get a feel for I think what we need more of. We started out, Rachel had an amazing outline, which I will get shared before the end of the meeting, I promise you. What might not be a bad idea for everybody, if you want to drop your emails in the chat in case I don't get it all worked out like I think I will. That way I can email it to everybody. But we're just gonna, but that started out really long and really full, and I could see this becoming like a series. I could see this thing just getting really big. There's a lot of information here. Trigger warning, absolutely. There are going to be syringes, and there's going to be tourniquets and all that kind of stuff. At the very end, we're actually going to do kind of a role play where I'm going to be the participant and Rachel's going to talk me through. I am not going to inject anything into my body, but I will actually stick myself. So trigger warning there, but that will come at the end, and we'll let you know before we do that demonstration. I just want to make sure that we're real transparent with everybody as far as that goes. All right, and that's kind of it. But okay, yeah, that was it. You already said I was a nurse and all that kind of crap. So yeah, we're good.
All right. Well, thanks, Jessie. First off, I want to do some shout outs. First off to Jessie for agreeing to collab on this and set aside time to connect and be there for each other and learn from each other and share little tips and tricks. Also want to give a shout out to Chris Schaffner at Jolt in Peoria. When I first started talking with my boss, Sarah, about this, you know, in just the need for more participant education, I had reached out to Chris at Jolt, and he had an amazing PowerPoint presentation that he kind of let me look over. And it was really helpful for me in thinking about how do I need to phrase things with participants in a way that's going to meet them where they're at and encourage discussion and proper technique. So shout out to him. And shout out to Sarah too for, you know, supporting me on this journey of harm reduction and just learning how to meet people where they're at and improve their health outcomes. When we're helping our participants, you know, how do we assist and how do we assess? You know, I think a lot of times when we're in the field and or we're a drug user ourselves, we're going to know when things are working and when they're not. You know, for me, I think one of the first things is if I'm kind of doing a once over on someone and just checking in on how they're doing, if they're having a hard time with injection, I'm usually going to see they might have some swelling or some redness. They might have long sleeves on when it's summer. You know, there might be things that they're covering up because they've missed or they have an infection. So that's sometimes a sign. And then there's other little things that you can kind of look for as well. Like maybe you see that there's like some dried blood on their shirt, you know, that might mean that they may not have the proper tools to like, you know, clean up maybe after injection, or they might be kind of on the go and in a hurry. Other things to look at would be if it's someone that is like in a bigger body, you know, it may be harder for them to find a vein, or they might need to use a different gauge. So there's just kind of those like physical cues that you can look at when you're meeting with someone, a meeting with a participant. And then in terms of assisting, you know, I may use that time to be like, oh, okay, I'm seeing that your arm is a little bit swollen there. You know, how is injection going for you? And then they'll usually tell me, they'll say, it's going really good. You know, this week I'm not drinking a lot of water, so it's not going so well. And I'll be like, oh, okay, you know, and just really doing the active listening thing, because one thing that we know is that people who use drugs, there's enough shame and stigma. So as a harm reductionist, we really want to offer support and encouragement and never say you're doing this wrong or don't do that, or, you know. So I'll usually say, well, would you like some assistance? If you want, you know, I do these vein care workshops with my participants. I can show you kind of some tips and tricks that worked for me. And sometimes people will say absolutely no, you know, even when it's clear, like, you know, they may benefit from some help. But the truth is they will come when they're ready. It's just like testing or other interventions that we use. You know, people may not always be ready right away, but if they know that you're offering no judgment and a safe, supportive place, they know that you can be that safe person eventually. So even, for instance, yesterday, I had a participant who was having a lot of trouble. And I said, well, you know, this is something I can help you with. And it was like, no, I'm fine. And then I went to go eat some lunch 5 minutes later. Actually, can you come back and help? You know, so it was like one of those things where you just kind of encourage the conversation, and you never want to push things on anybody. You know, you want it to be about the person who uses drugs having autonomy of their body and feeling independent, and that you're there to support them and walk alongside them. You know, it's not that you're necessarily that you have power over them. It should never be anything like that. And I usually really like to start with education with harm reduction principles, you know, what harm reduction means, and that people who use drugs are worthy of dignity and respect. You know, you use drugs, you're not a bad person. People use drugs for all kinds of reasons, just setting the tone, you know, for that conversation. And then I usually talk about how injection of drugs is a ritual, and how it's important to take your time. You know, this is an important ritual for you. And we need to set a setting to start it off the right way. So we'll go ahead and start talking about IV education and injection. So what does it all mean? So I want to pass it over to Jesse to talk about a little bit about gauges and CCs and length of needles, because I know I have participants that prefer a certain kind. So Jesse, can you talk a little bit about that?
Yeah, all right. So when we're talking about the different gauges, the different, different lengths, the different CCs, that type of stuff, definitely, I've got participants who are very, very set in their ways, who, very much want what they want. And I try to respect that. I try to offer what I can as much as I can. But I also try to keep in mind the principles of harm reduction and exactly why gauge matters, why length matters. We know just from a purely logical standpoint that if we stick something with a smaller needle, it's going to do less damage, especially if we stick with a smaller needle over a period of time. If you've got someone who's injecting 4 to 6 times a day and they've got their several little favorite spots to go, it would be better if they could use the smallest gauge possible, which 30, 31. Now those are tiny, 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 tiny. A lot of participants don't enjoy that small of a gauge needle. If they've got a lot of scar tissue to go through, those little gauges are going to just bend and just act like a piece of limp spaghetti going in the arm. We know that. Also, for people here, especially down here in South Georgia, I got a little gnat here. That's what I'm doing, y'all. The gnat. Y'all forgive me for doing this. It's a gnat. I don't know, about Raleigh up in North Georgia, but down here in South Georgia, our folks that are using IV opiates, they want bigger gauges because they want that rush, they want that euphoria, and you're not going to get that trickling it in with a smaller gauge needle. So that's a lot of the pushback that I get down here. Where down here I do offer 29s and I offer 30s. 29s, of course, are bigger than 30s. Some people down here want 31s, teeny tiny. We do the 5/16, which is the 8 millimeter down here. And then we do the 13 millimeter, 12.7, I think, or the 1/2 inch is what we have down here that I can offer. I try to not personally sway the client one way or the other in what they want to do, other than just providing them with those facts. If you've got a lot of scar tissue, we may need a bigger gauge needle. If you are in a thicker body, we may need a bigger gauge needle. I mean, a longer needle too, because we've got to get to the vein. If you're using purely methamphetamine or something caustic, you shooting coke or meth or something like that, I would like to see them try to use a longer needle. I would like to see them try to use a 1/2. And because a lot of what we're getting down here are abscesses, getting a ton of meth abscesses down here. And what I have found, I've started instructing those that are using methamphetamine IV, once they register and once they have pushed their substance in, count to 3 before pulling the needle out of their arm. And that's given it time, that's given that meth time to be carried on up the bloodstream away from the puncture site. Since my participants have started doing that, we are seeing a lot less meth abscesses, a lot less redness around the injection site, just by simply allowing that substance to clear the puncture point before they're pulling the needle out. So things like that are those are the type of things that I'm trying to focus on down here, as far as like the length and the gauge of the needle. How much body tissue do you have to go through? How much scar tissue do we have to go through? What are you injecting and how caustic is it? And is it better? Is it going to be better for your veins and your skin to use something longer or bigger or shorter and thinner? So what you got, Rachel?
Yeah, that's excellent. So I'm guessing many of us know, but in case you don't, so the higher the number, it's going to mean the smaller the needle, like the smaller the around it. So higher you think, oh, that sounds really big, but like a 31 gauge is actually going to be a smaller needle. 27 gauge would be bigger for like if there's a lot of scar tissue or deeper veins. So like potentially for somebody who may be an IV user for 15, 20 years, you know, they may need a 27 gauge to kind of get down in there to the tissue where they can hit the vein. Any questions about like gauges or cc's, lengths of needles, anything like that before we move on?
I have a question. How do you know like if they have scar tissue, or is that something that's intuitive to them?
So I'll let Jesse go here on that one. What do you say, Jesse?
You're gonna probably be able to start to see it if they've been injection users for a while, or even if they haven't been, but maybe they've had to use subpar equipment, they've had to reuse syringes, and they've caused some trauma to the area. You'll be able to feel that scar tissue. They'll start saying, you know, I like to go in this place here, but you know, it feels like I'm really having to, you know, work to get through it. So, and it also, you're going to talk, you know, take their history and find out, you know, well, how long have you been doing this? And, you know, do you always have access to, you know, to sterile supplies and new rigs? And if they're saying, you know, that they haven't, then they really don't even have to be injecting long at all to have really scarred down a vein if they're using, you know, subpar equipment. So it's going to be by feel. You're going to be able to feel that tissue. It's not going to be that nice boggy vein tissue that we know that's spongy. It's going to be hard. And they're going to report difficulty getting in that area.
All right. Any other questions before we move on? That was a good question. All right, we'll keep it moving. So next we'll talk a little bit about tying off, so like tourniquets and the importance of them. So I know for me, when I was using, I never used a medical tourniquet. I really didn't have harm reduction in the community that I have now that I'm able to serve. So I used a belt. However, I've learned belts aren't always the best because they can kind of distort your vein a little bit. And sometimes when you're tying a tourniquet, some folks think if you tie it tighter, then you're really going to get the vein popping and you're really going to get in there. But unfortunately, what it can do is, so you have your vein and then you have your artery underneath. So if you're tying your tourniquet, you want it just to do this to the vein. But if you're tying it too tight, it's going to do that and that to the artery, which you don't want. You want that artery to keep flowing. So the best thing that you can use is going to be a medical tourniquet. So something like this that's nice and stretchy. And you're going to tie it like so, kind of like, so there's like little bunny ears. Then you're going to take this and tie it just underneath like so. Not tie it, but you're going to push it underneath. And what that does is that's going to allow it to have this little pull right here. So once you have your shot in your arm, you've pulled back and you've seen the blood that you're in the vein, you'll be able to just pull it off quickly like that, and it'll just snap off. And because of using this, you're not going to have as much pull and like moving the rig and stuff when you're trying to get out of there. So hopefully that explains a little bit of the importance of having a medical tourniquet. And I've also heard folks say, well, I have really great, thank you. Not as called a slip knot. Yes, thank you. I was having a fog moment. Appreciate that. So some folks will say, well, I have great veins, I don't need to use a tourniquet. And that might be true, but it's a good habit to get into because eventually, you know, you might need to use it. So it's a good skill to have. Does anybody have questions about tourniquets or how to tie them or the importance of that?
Even, this is Jessie B again, even if you have great veins, I've got magnificent veins. It's not, if they're, let the participant know that even if they're not needing to use the tourniquet to visualize their veins or palpate or feel their veins, it will anchor the vein. If they tie the tourniquet, you know, snugly, what it's going to do is it's going to help anchor the vein in place so that it doesn't move. That's also important.
Do you have tips for if those certain people don't like the medical ties? Do you have tips for, they say a lot of our people use scarves. Are there, I mean, I guess maybe is that better than a belt, or is that, what kind of recommendations do you give for people that use something other than a belt or a—
Kaylin, my baby prefers do y'all remember, some of y'all may, I don't know, some of y'all are probably kind of younger in here than I am. Back when we used to wear the high top tennis shoes that had the wide, like half-inch shoestrings that were all the different multicolors, they're real stretchy. That's actually what my baby prefers to use, is a shoestring. She has a loop tied at the end of it. And a lot of them use this too. So what this is it's a medical grade but tourniquet, but they put a zip tie or a loop at the top of it so that they can take and make it, you know, like just a slip, you see, like that. And then they can put their arm, you know, put their arm in that and just tighten it. But then when they're done, they just let it go and it loosens on its own. And that's wildly huge with my participants. I offer them these. She does the exact same thing with a shoestring, Kelly. She's got the loop at the end and she just pushes it through, and then that way she can pull it with her mouth. And then when she lets it go, it loosens enough for her to complete her shot. I try to listen to what the participants prefer, and then I try to think about, okay, how can we take what they prefer and make it more user-friendly, make it more sanitary or whatever. But yeah, scarves, shoelaces. For a while, one of her favorite go-to things, which was not my favorite thing for her, but you know, there again, it's not me, was chargers, phone cord chargers, because they're slippery, because they, as soon as you turn them loose, they slide out. So she likes those too.
Is it
Hey,
okay
Blue.
to jump? Oh,
I'm sorry, I saw Blue's hand up. Go ahead, Riley, and then I'll call Blue next.
I was just gonna like jump in on the conversation. One thing, I know like our mouth isn't necessarily the most sanitary thing, but like one thing that gets hard is like if you're alone or if you don't have someone else to untie it for you, it can be really difficult to, I mean, really, if you use your hand to untie it, that syringe is just gonna be bouncing around. And that's like not cool for many things. But this is like using your mouth, but I will show folks with your mouth and the slip knot. So just like there, if you can see that. So all that has to happen is this one is pulled. So then if this one's in your mouth, and you can do this for anywhere on your upper arms. So then if you're hitting your hand, say this is up higher, if you're hitting your ditch, but as soon as you get it, that's all you have to do. And then pop it in. With there's so many other like things that we can use. I personally did like the belt thing and would put it under my legs so that I could squeeze my legs and loosen it. Because when you're alone, that's the hard part, is like, how can you loosen it once it's registered without losing it? So that's that. I mean, for me, that's like the hard part of the conversation. But man, sometimes with like shoelaces and like folks will use really small things that really cut stuff off, but you can't easily get it off. So the loop thing or anything that will slide itself easily is just so much better as far as being able to decrease that pressure prior to, like after flagging, but prior to injecting. So I just wanted to jump in there with that.
That's perfect. That's
Awesome, Riley.
Yep. All right, Blue, what you got, Blue?
So Riley actually mentioned one of the things I was going to mention, just about making sure folks don't set the needle down and, you know, let it move around. And so I have this technique that somebody taught me years ago that I teach, but I also would just, I was a licensed phlebotomist, but this was sort of not something that they covered. If people are injecting in their arms, I will tell them, if you get like one of those small cans of pineapple juice or like a 16-ounce bottle of whatever drink, and you put it under your armpit, then when you register, you can just kind of move your arm a little bit and it'll drop because it's heavy, and that will release the flow. But then I thought, well, I don't actually know if that's also cutting off the arteries or anything else that might be bad. But that's another thing that I used really successfully when I was injecting and alone. So That's all I have. But thank you, Riley. You covered a lot of what I was going to ask about.
Nikki, what you got?
Hey, are you able to hear me?
Yes.
Okay, my question is, I know when I'm packing supplies, I take into account like being as sterile as possible, especially with like the tourniquets. So when they're using like other things like a charger, like a cord or a shoestring, what does that look like in terms of like I guess being as clean as possible? Because I tell them if they're going to reuse the tourniquet to at least you know, let it be their own, or you know, wipe it with alcohol swabs. So if they're picking up a random charger cord or shoelace and putting it over another open wound, you know, I just want to make sure that they're being mindful and careful as possible. So do you have any tips or anything as far as that goes?
I just try to tell people if they're, you know, if they're reusing things, and I mean, you know, tourniquets, the outside of our skin's not sterile, tourniquets are not sterile. They're gonna share stuff like that. I just try to encourage people if they're sharing things like that, maybe they have their own clothing, they can pull their shirt down, you know, and tie off over that piece of clothing, or you know, wipe down their tourniquets, wipe down their phone cords, or whatever it is that they're using. And then just, if they were to get it contaminated, if they were to get blood or something on it, you know, try to toss it, you know, if they can, if they've got something else they can use to try to toss it. But that's about the best we can do, is just encourage good hand washing, try to keep them with some hand sanitizer, and, you know, have them wipe stuff down if they're sharing.
Okay, thank you.
Good question.
We should probably chat a little bit about where the tie should be in relation to where they're hitting. Because if it's a few inches higher, there's a good likelihood that like whatever it is that's on the tourniquet isn't going to be in the same space at where they're injecting. But I don't know. I know some folks are like, should I do it an inch above? Should I do it 6 inches above? And I'd see people that would tie up way up here in order to like hit their hands. So like where the tourniquet goes might be a good conversation.
Mm-hmm. Definitely. You know, it's no more than, and some people like to put it on when they're hunting. When they're hunting, you know, they're hunting veins. They're going to put it up real high so that they can look down their whole arm. And you know what you know, of course, I don't encourage using the hand, but you know, there's veins there. You know, no more than 2 inches, above where you're going to inject. And we don't want to leave the tourniquet on for more than 1 minute at the time. Okay, put the tourniquet on, you're looking, you've got your hand in a dependent position, you got it dangling down, you've just done 20 push-ups, or, you know, wash your hands under some nice warm water, something to get that blood flow. Tourniquet on for a minute. And if you're not seeing anything, release it, because we're doing some damage to those valves, increasing the pressure inside the veins when we do that. So you definitely, you know, no more than 2 inches above the site that you think you're going to go, and leave it on for no more than a minute at a time if you're hunting veins.
So it looks like we have a really good question in the chat, which is from Casey, and it says, does it often happen that people fail to untie a tourniquet after injecting? Is that a significant safety concern? For example, choking off blood from the limb for more than a few minutes are not really a common problem. In my opinion, I mean, it's ideal to release the tourniquet before pushing the plunger, but if you're afraid that you're going to go out of the vein, I would say it's okay to push it, but then you want to take that off, because like Jesse said, you don't want to cause damage to the valves, and you also want to allow your shot to go in and flow, because if you have that vein and it's blocked off, then when you push, it's just kind of chilling there. You're going to feel a better rush if you get that off and push versus leaving it on and pushing. You're not probably going to feel the same rush that you would otherwise. What do you think, Jesse?
Well, you're going to blow the vein. That there's only so much pressure that vein can hold, and it's got the back pressure of the blood from the tourniquet, and now we're going to add another half cc to a cc of volume. into that already engorged section of vein. So the risk of blowing the vein, being in, getting a good register, thinking everything's, happy-go-lucky, and then you start pushing and you got to miss, then that's not going to be good.
That was my experience also. Like I have blown a few, like I'd say kind of medium-sized veins because before, when I had like my big old like water hoses, I could keep the tie on and everything was fine. As my larger veins, I lost them due to scar tissue and then was hitting smaller ones, it was different. Like it was a different experience. And I completely blew veins a few times. Or you could literally watch it and see it as you were injecting, it would will swell up and you can see it. And just what you were saying, as far as the pressure, you can only fit so much in. And then as years went by and like super, super small veins, you just can't, you can't have the tie on because it literally will not take it. It just won't take it. But that was my experience, that it depends on the size of the vein as far as like how well, if that's even feasible or not. Yeah.
So we have another question in the chat. Lee has a client that was having a hard time getting a shot. What's something we can tell a person who's struggling and getting sick trying to get a shot? I would say, we're probably not going to talk about skin popping and muscling today, just IV injection. But I think one thing that I find with participants when they can't get a shot, oh my gosh, I can't get it, I'm so sick, it's like their blood pressure, they get really anxious and upset. And so I usually try to do some grounding techniques with them. Like, hey, it's okay. We're going to make sure that you're not sick today. We're going to figure out a way that's going to work for you. Let's take a deep breath together, making sure their feet are flat on the floor. Take off the tourniquet, rotate the injection site. So like, let's say you're going over here. You're going to move down the vein. So like, let's say they missed way up here. You're going to move down a little bit farther. If they miss here, you're going to move down a little bit farther. You don't want to start here and then go up here and then go down there, because then you're going to be working through really swollen, like irritated tissue. I think bend of the arm is really good. Right in here is also really a nice spot. Hands can work sometimes, but you have to remember that we use hands for everything. So it's really important to have good hand washing practices before you're going to inject, or use like antibacterial, like the hand sanitizer. And it also tends to hurt kind of bad. So you want to use a smaller gauge, like a 31 gauge for that. And then in terms of no-nos, absolutely, like no, in my opinion, I'm going to say that for me, is going to be your vein in your neck, because that's going to be next to your carotid artery. And that vein is also going to flow to your brain. So you don't want to develop an abscess or something like that that can either get in your bloodstream and cause sepsis, or like a brain abscess or anything like that. So I think arms are really good to start with. Once you have missed on your arms and that's a no-go, I do usually go for the legs for people, but I do think it's important to also talk about the circulatory issues that can pose. So like DVT, you're not going to have as good a blood flow down there. So let's say you do need to shoot in your leg. I always thought we should move further up the arm so the shot doesn't have to travel through damaged or inflamed part of the vein. I was always taught, you start and then you move down the vein. But I guess if you start down here and you move up the vein, as long as you're not going through the, damaged tissue, it would be okay. What do you think, Jesse?
You don't want to go to the same vein our veins are they bifurcate, they branch off. So you can move down if you move left or right. You have to move off of where you were. I try to, of course, everybody's going to just go for the antecubital and then try to move around. Going up above, ideally getting above where you've missed or where there might be any infection is always better. If you're going to move down, you need to move to the side, left or right, to get off of that main, whatever that vein is that you're trying to stick. If you've recently stuck somewhere and then you go, well, like if I stick myself now and miss, and then I were to go right below it and hit it, and if I did my shot, my substance is going to come out the hole that I just poked in the top because it's still that fresh. So yeah, we want to try to work up if we're having to work on the same vein.
Perfect. So after for me, if I couldn't hit on my arms, I would usually go to my leg, which, like I was saying, you know, the circulatory issues. But what I found is if I can get a good surface like a desk, then you can put your leg up here, and then I can tie my tourniquet like this, slip knot. And then there's a really nice vein that's going to be right next to your shin bone here. And just start there. And then you can kind of, it's also something to consider for participants or people who you're wanting to not have any visible marks. So Jesse and I were talking about this, you know, if you do sex work and you want it to be kind of private and you don't want any visible track marks, your leg is a good option. If you have a partner that's not supportive of you using, you know, maybe that's a good hiding spot. So those are areas that work for me in the past. Jesse, do you have any pointers on good like injection sites and safety with that?
You know, I think you pretty much covered it. Someone just asked, are there other big areas people should avoid inject? And, you know, we definitely want to stay away from below the knee simply because, you know, of circulation. We try to not go below the knee. Try to not hit in the feet. You know, if we think about that, you know, circulation is typically poor down in our feet, no matter if we've got circulation issues or not. And a lot of the people that I serve are, they don't have vehicles, so they have to use pit and pat to get them where they have to go. And if they've missed a shot, their foot's swollen, their foot's hurting, now they've rendered themselves immobile as well. And that, you know, we don't want to do that. Try to avoid hitting the neck. We try to avoid that. I know a lot of people do it. That's not one of my favorite things, but I do teach it if people really, you know, if that's what they need to do. I'd rather them do it the right way than try to figure it out on their own. The femoral, you know, we've got femoral veins there and, you know, for our, you know, in our groin, really try to not hit that because that's one place where the vein is actually very close to the artery. And a femoral artery bleed is really, really freaking impressive if you've never seen it. And it can really take somebody out of the game pretty quick, even just to be stuck with something as small as a 30 gauge needle. So those are going to be the big places that we're really going to want to avoid. Going to want to avoid the wrist. A lot of people like to go in the wrist because they see all these pretty blue veins and they think they're wonderful. But your radial artery is literally right there. It's the artery that's going to be closest to the surface of the skin. And it's easy to hit and it hurts like a mother when you do it. And it can actually cause nerve damage into the hand, especially with these 3 fingers. So it really is important that we try to discourage people from using these areas and that they understand the why. Femoral artery, you'll bleed to death. Radial artery, that radial nerve is right there as well. You could really use the use of your first 3 fingers, of your 2 fingers and your thumb. You know, hitting in the neck, then you're going to run the risk. The carotid artery is, you've got an internal and an external carotid artery. And thankfully the external carotid artery is important, but not like, it's not hella important. Like the internal carotid, you'd have to be digging for fish bait to hit your internal carotid artery. The external carotid, though, we still don't want to hit it because it goes to the brain, and that's what we're not trying to do. So.
All right. We'll keep it moving. We're at 1/4 just if anybody's keeping track of time and needs to go here. But we hope you can stay. So injection sites and safety. So yeah, that's hilarious. Digging for fish bait. So when you're getting ready to shoot up, you know, you want to clean your hands with soap and water or hand sanitizer if you can. Keep your hands safe. You want to use the right gauge or syringe that's right for you or the next best thing. Then you're going to tie off. You're going to use the alcohol pad before you inject. Jess, do you want to say anything about the alcohol pad? I know some people, you know, when they use it, they're going to go like this. So let's talk about like the right way to use an alcohol pad and why that's important.
To have an alcohol pad in of itself is a blessing. It's like manna from the sky. Now, I try to give mine alcohol pads. I don't know what they do with them. I think they eat them. But I do give them hand sanitizer if they have nothing else. And what I tell them is, you're gonna take your out. So if I'm gonna inject right here, because I got good veins. I'm gonna start in the middle, do that, and then I want to go out like that, and that's it. That's all they got to do. Just start in the middle where they're gonna inject, and then do a circle and go out. Don't scrub back and forth or up and down, but you know, I mean, get in where you fit in, and if that's what, you know, whatever they'll do for me is gonna make me happy. But I just, you know, try to tell them, start in the middle and work out. Don't blow it. They're gonna want to blow it to dry it off quicker. Well, now you just blew the cooties back on it, so now we got to wash it again. So don't blow it, don't fan it, let it dry, and then you should have a nice clean surface to work off of. Don't touch it again with your finger after you've cleaned it. But if you have to touch it again with your finger, at least alcohol your finger off first too. At least have a clean finger on there. Don't lick the tip of the needle. Don't lick the tip of the needle before you stick it in your arm. People do that. They think it lubricates it. It doesn't lubricate it. The needle's already got a lubricant on there. It works just like it's supposed to. So don't do that.
Yeah. I liked what you said, Jess, about like, you know, after you wipe, don't go back and feel for the vein, you know, like ideally you've found your vein already. I want to talk about like watering down your shot, just the importance right now of just the poison drug supply that we have right now. We really don't know what the hell is in anything. So it's good to water down your shot because you can always go back and do more and you can't do less. So I'm going to show just on this hand dummy, or arm dummy, trigger warning here. So here I got my arm guy. So we're going to tie the tourniquet like so. I don't really like this arm dummy because the veins are not like a normal person. So it's really not like ideal. I already used my alcohol wipe, but pretend I used one. I'm going to go right down here. So I'm feeling with my index finger. It's important to feel with your index finger. Your thumb has a pulse in it. A lot of my participants, they're really excited. You know, they got their stuff, they're ready to go. But if they're feeling for the vein, they might be going like this, or, you know, like playing the piano on their arm or something. And you want to remember to take your time with finding the vein. So pushing down, you know, feeling for that spongy give, you know, when you push, it's going to feel like a hollow pasta tube, like penne pasta. That's how I always describe it, penne pasta. You see how that feels like that? And when I'm teaching someone, I also, sometimes I'll let them feel my vein, you know, see how this vein feels like this, you know, how does yours feel? And having them be really mindful about what that means. And then this is a short. Oh, what's that?
Arm a little bit. Can you move the arm a little bit? Because it's actually out of, there we go. Yes.
Can you see it? Okay.
I can now. I just couldn't see that. It was like off the screen. Okay.
Sorry. Yes,
Oh,
you're
okay.
welcome.
Thank you.
So this has a slip knot here. So I felt for my vein and I'm going to use a short syringe. So pretend that I've used the alcohol wipe, right? And then when I shoot, I'm going to do bevel up. And what bevel up means is I like to think of it as like a little scoop. You want it to look like a little scoop. You don't want it to look like that. You want it to be bevel up. And the reason that's important is because you want it to puncture the skin. If you do it the other way, it might still work, but it's going to hurt a little bit more and damage your vein. So don't do that. So you're going to just push in at a 45-degree angle. And I'm bending the syringe. Hold on. You're going to pull back And if you can see, this is filling with red Powerade. I'm gonna let go of the tourniquet here. And then since I'm in, I'm gonna push it really slowly. And then I'm even gonna do the technique that Jesse talked about, which was leaving it in 1, 2, 3. We'll pretend that this is ice and that we want it to flow like Jesse talked to us about, so that there's not any abscess or any other like chemicals or infection that could occur. Then we're gonna remove that. I got my cap over here. Hold on. Got my cap over here. So I'm just gonna do this trick where I do this, scoop it up like that, and then put it in my sharps container. So that wasn't a very good injection session just because it was with a fake arm, but yes, I did pull the plunger back. If we have time at the end, I can show again, but Jesse's also going to show real life demonstration, which I think is better than a dummy arm with Powerade in it, because we know that that's just not real. The skin is much tougher. It's just not legit. So let's see. We've talked about where to inject, where not to inject. Let's talk about feeling for veins when you're not in a rush. So like, let's say you're in the shower, that's a great time, you know, taking a bath, taking a shower, you know, feeling around, watching a movie on your phone, you know, you can, that way, you know, you start to get to know your body and you can learn where these veins are, so that when you're in a hurry, you don't have to sit and look and get frustrated. Let's see, we talked about the bevel. So you should see dark red blood when you pull back. If you see bright red, or it's bubbly or frothy, or even like pushes the plunger back, you're in an artery. And so you need to remove it, put a gauze pad on it, Band-Aid, and like just kind of elevate it for a little bit. If it continues though, definitely go to the hospital. Let's see, saliva and mouth have so much, if they use anything, I would suggest an alcohol wipe. Oh, they're talking about licking. So yeah, I see that all the time actually. So with folks, after they inject, they see the blood and they lick it. And I completely agree with what Blue said. There's so much bacteria in your mouth. Alcohol wipe might sting a little bit, but it's going to keep it clean. You know, just like put a little gauze pad on there and a Band-Aid, and then you're set. Let's see, we've talked a little bit about veins and arteries, nerves. If you're in a nerve, it's going to really, really hurt. Listen to your body. If it hurts or it burns, pull out and start again. Use a new needle every time. If you miss with one shot that you're doing, pull it out, use a new one every single time. If you can, if you have it. Let's see here. Some other tips and tricks for injection success. So sometimes I'll see people, you know, it's almost like they have really low blood pressure. Like they might be really malnourished, you know, they might have a vitamin deficiency. They might not be hydrated. So I'll talk about that. I'll say, hey, when's the last time you had a snack? Here's a snack pack, you know, eat some peanut butter and crackers. Like maybe you'll feel a little better. Here's a bottle of water. And then sometimes Jesse and I were joking about this, telling a participant to say, hey, drop and give me 20, you know, push-ups or jumping jacks, something to kind of get your blood flowing will help a lot. And also not smoking if you can for like 30 minutes before you inject. So smoking is going to constrict your blood vessels and make it harder for you to find a vein, which when you're stressed out, of course you're going to go for a cigarette. That's going to calm you down, but it's going to make it harder for you to shoot up. Another thing that helps, like a warm shower or a bath, or a warm compress or heating pad. For me personally, in the past when I used injection drugs, I would actually get all my shots ready and then I would hop in the shower, and then that's when I did it. Was that the safest thing? Probably not, because if you fall, you know, it's just not ideal. But showers can definitely help you to find a vein.
Oh, you froze up, Rachel. Can y'all hear me? Y'all can hear me? Okay, Raleigh. Yeah, Rachel is froze up.
Yeah,
Let me
can
see,
hear
what was it?
you, but she's frozen.
Yeah,
You're fine.
I'm not froze up though, am I? I'm good.
Yeah, you're good.
I'm good.
To another, I think I cut out a little bit. Can you guys hear me?
Yeah, you
Sorry.
cut out a good bit, but it's okay.
So sorry. Yep, it's saying my internet's unstable. So rotating your sites, taking a break, and also we'll talk about this in another session that we do, but utilizing other methods. Let's say your arms are all torn up, you can't get it. You know, that might be a good time to booty bump, or maybe you smoke it or snort it or eat it. You know, maybe you let your veins heal up a little bit, you get your sick off, or you get your fix, you get whatever you need. You're not damaging your arms and hurting more. And pumping your fist is going to work good. So like when you got that tourniquet on, pumping your fist, you know how they do that at the doctor's office. You can flick your vein a little bit. You don't want to slap it, but just taking the tourniquet off before you inject. Going slow, push it really slow. If you push it really, really fast, you guys know how Riley was talking about earlier, if you have that tourniquet on and then you feel it bubble up, if you push it fast and it bubbles up, that hurts when you miss a shot. And then you're also not going to really feel it. It might take longer because you've kind of muscled it. So go really slow, because then if you go slow and you're out, pull it out and then just start again with the new rig. You want to always shoot towards your heart, not away from it. And we also talked about this. If you miss, you're going to pull out and apply gauze and a Band-Aid using a new needle every time. And this is also a great skill to be ambidextrous. So you can shoot with your right, you can shoot with your left. That's an amazing skill to have. And I want to talk about how self-injection is a really valuable skill. If you use drugs, you are worth being in charge of your body, and that comes with learning how to inject yourself. I have a lot of couples who are kind of reliant on the other person, you know, to inject. And so what happens is they don't know their dose of their shot. They don't know necessarily what they're putting into their body. They don't know the gauge of the needle. And so if you can teach someone else how to inject safely, you're saving them from so many other things, infections, communication about this is my body, I know how to do this skill. You know, it's important to be able to take care of yourself in this way if you're a person who injects drugs. And the other thing too, even if someone's trying to help, you know, if someone's injecting you, they're not going to know if that burns, if it hurts, you know, you are going to know, you're going to have those indicators in your body. So that's another good reason as well. And another thing I forgot to mention earlier was good lighting. Good natural lighting is huge. Sometimes like I'll see where someone's using and the lighting's really dim, you know, they might have like just not good lighting. It makes a huge difference for people. Let's see. Injection complications. So Jess and I talked about not going too much into this. We can do it another time, but let's talk about missed shots. So, okay, you've missed a shot. What do you do? Jess, you want to take this one?
Yeah, I was answering the question. But so if you miss a shot, what do? Apply pressure, of course. If they are able to, you know, apply some heat to the area, get some white blood cells going to that area, try to get some of that contaminant pushed away, drawn away. If they miss, they're going to want to try to shoot in the future above that missed shot. They don't want to go below it. They want to try to go above it if they can. One of the, you know, the biggest thing is that if that shot's missed in that area, they're going to have to try to leave that area alone for a while. If it's a shot of meth, ice, whatever they call it, that's going to be extremely caustic, and they really, really are going to need to be hyper vigilant about keeping heat to that area, keeping pressure on that area, and watching it for that redness to start turning a purple color, which could be, you know, indicative of tissue necrosis, of tissue death, and that's what we don't want there. And then just trying to figure out what's happening that they're missing the shot. Why did they miss it? What happened? What went wrong? And, you know, just correcting it so that it doesn't happen again. If they bloody their shot, You know, a lot of people, what do I do with this shot? I got a syringe full of dope. What do I do with it? I've bloodied it. Can I refilter it? Can I do this? Can I do that? That's when I really talked to them about boofing it. You know, no, no, I don't want you to refilter it. I don't want you to try to, you know, do anything to it, but, you know, get it in a syringe that you can shove it up your butt. And, you know, we're going to hopefully, that's going to be another one I hope that we can talk about. We'll do a section on boofing, because it's really a good way to reclaim that shot, you know, without wasting their substance. And it empowers a lot of people, and it cuts down on a lot of their anxiety when they know that, yes, you've got a bloody rig, but it's okay. You can still work with it. Let me show you how.
Is it safe to boof if there is blood in it? It is okay?
Mhm.
Okay.
Yeah, it's okay. What's going to happen is even if their syringe has got blood in it, Riley, it's fine. They can go on and boof it. But now they're going to pass that blood clot at some point. They got to remember that they put a blood clot in their butt. And so when it comes out, they don't have a heart attack, you know, and they don't think something's wrong. But yes, the capillaries there on those anal columns will pull the substance out, and they're just going to pass that clot. That's all.
Okay. That's like, I did a lot of my using on the West Coast, and it was tar heroin, but down here it's so different. There's fentanyl and everything. And like people here can't muscle like we could 20 years ago. You know, it's just different. And we would always get to that line of like, how much blood do I have in this? And when can I muscle it still safely? But being down here, if there is blood in it, you can't muscle it. But I don't have a lot of experience with boofing. So if you ever do one of those, it'd be cool to learn about.
Yeah, that's something that I really work a lot with my clients on that down here, Riley. And I mean, before we get something officially going, if you or anybody else kind of want to do something, I'll be glad to just us meet and get something going and help you with that, because it really works so well. It really does. Yeah, we'll just get together.
Let's see. Casey says, what about if someone saves those clotted shots for a week or two until they are no longer clotted and then use it? Of course, okay. So if somebody does save their shot, anytime that there's any kind of blood, that's going to put you at risk for sepsis, endocarditis, other infections, because blood is going to grow bacteria. So really within any amount of time, if there's a lot of blood in there, because like, think about it, if there's blood in your shot and you're redoing it, you're not even going to be able to see if you register in the vein. So boofing is really the best thing, I think. But yeah, if they're saving that and they're using that could really make them really, really sick. Really
and
sick.
by the time they've had their substance mixed up for a week or two, they don't have a substance anymore. If they're mixing up what they think is heroin, fentanyl, whatever, I mean, that's gonna completely break down. And by the time they use it, they might have a little bit of tiny bit of morphine left, tiny maybe, but not. It's going to completely break down and denature. And who knows what they're going to have in the end. It's probably not even going to be what they started with, even close.
That's the thing though, with like those of us that do have really bad veins after so many years or decades of using, and that anxiety that happens. And like, once you get so much blood in it, and just like she was saying, like the more blood you get in it, the harder it is to even tell if you're truly registering, or because sometimes it'll like leak in, but it's not actually a hittable vein. And then that anxiety of like, I only have X amount of time to get this in me or I'm fucked. Because once there's a lot of blood in it, the longer that time goes by, the more you can't use it. So if somebody's saving their shit for like, that's just all bad. But or that like cotton fever, we call it cotton fever. It's that same kind of bacteria thing that where like you want to die, or you feel like you're going to die, or you'd rather die than feel what you're feeling. But it is like, the more blood, the all bad it is.
And to clear up some questions too. So like, you know, we're talking about when you've missed a shot and your syringe is full of blood and you can't see, you can't register, then that's when you can turn to boofing. When you're pulling back initially, you should see a little bit of blood kind of sprinkle in there. That's okay. That means you're in the vein, just to clarify, if we have anybody here that was curious about that. So we're going to kind of get ready to wrap up here in the next like 10-ish minutes. We've gone a little bit over. So best prevention of injection complications is participant-centered education. So that means, you know, we know that participants, this is what I've learned from doing harm reduction work. So I want to give a shout out to all the folks that are in here from that group, you know, and I believed this before I joined that group, but you know, people who use drugs are the expert of their own lives. And so we want to remember that when we're giving them education, when we're passing along what has worked for us, we want to follow their lead. So what works for me is utilizing motivational interviewing. So using reflective statements to kind of clarify what they're saying and what they mean. You know, be an active, empathetic listener. And then follow their lead, because if they're asking for our help, they're being so vulnerable. You know, people who use drugs carry a lot of shame. And so if they feel safe with us, like, let's continue down that path of safety so we can keep people alive. So before we begin with Jess doing her demonstration, just want to say trigger warning, because there is going to be drug paraphernalia. So I'm going to pass it off to Jessie and we will see how to inject.
Okay, so trigger warning, I am going to stick myself with a needle. I'm going to pull back blood. I am not going to inject a substance into my body. Especially with it being recorded. My mama might be here. I'm kidding. I'm kidding. I'm kidding. But she could. I told her to come. Helen, you're not in here, are you? I know Lee's in here. Lee, my other mama, or Lee Asia Lee.
That's right.
Well, there she is, y'all. She ain't a myth. She ain't a myth. All right.
How you doing?
Bye, Blue. Love you. All right. So all I'm gonna do is just, so we do this in, oh Jesus. All right. Y'all like my shirt? My shirt's cool, ain't it? Like my shirt.
I'm gonna tell you to mail me that shirt.
Mute yourself, mother. I love, you can't have my shirt. All right, so my tourniquet is, I got the zip towel, see, because I'm not real good at stuff and I ain't done this in a real long time. So y'all just gonna see how long it's been since I've done this with me all fumbling around here. But I got it on my arm. I'm gonna just slide, like Riley said, it's my mouth, it's my tourniquet, right? So I slide that down like that. And now I can wrap it. See, there we go. So I got it wrapped. I got my boob holding it, but my teeth could be holding it. I've got a pretty good vein right there. Can y'all see it? So I'm gonna start in the middle. I'm gonna go out like that. All right. Now, one thing that I do, I'm gonna loosen this up just a bit. One thing that I do to help is the key ring. Has anybody ever taught y'all about the key ring? So you take a key ring and you loop it onto the end of your rig so that when I get ready to work it, look at there. Look at there. How brilliant is that? All from a good old hillbilly redneck person here. You let somebody from Omega, Georgia figure out something before we get it going. It's very helpful. All right. So I've washed, I've got my key ring on because I'm just one person by myself. I got my tourniquet. I got it tight. So I was told bevel up, right? But I'm gonna take this first. I'm gonna work this plunger. Sometimes plungers get stuck. Sometimes us harm reductionists keep shit in our car too long. Things happen. So I always tell people to work the plunger just a little bit, right? So I got the bevels up. Y'all can't see that, but the bevel is up. Now, my veins dry. Everything's good. I'm gonna take this, right, at this little bitty angle, right? Tiny angle. And I'm in. And then I've released my tourniquet, my titty let it go. I'm in. I can take my finger and I can work this thing now. I can pull back. I got flash. I'm good. It's in there. So it's just that simple. If I inject 1, 2, 3, then I pull out. And that's it. It's just that simple. My tourniquet was loose. And there's not even a mark where it happened. Because I went in at such a flat angle. Such a flat angle. Because of the key ring, I didn't have to manipulate. I wasn't doing a lot of wiggling and fiddling and fidgeting and all that kind of stuff. That's a game changer for people. I've taught so many of my participants how to do this with the key ring, and people who weren't able to hit themselves before are now able to hit themselves because this gives them that extra bit of control. I don't know where my needle went. I guess if I stick myself, it just gonna be my damn self, right? We'll do that so I don't kill myself. Okay. But that just that part right there has given people so much autonomy and so much freedom. They're not worried about their rig sliding out, of their arm when they're moving it around. Another thing that I've actually taught some people to do, some of the people that actually have a few more resources, get a piece of tape. If you're that worried about your rig sliding out of your arm, once you get your needle in your arm, I've already pulled the plunger out. Once you get your needle in your arm, just like we do when we're starting IVs, Kate knows what I'm talking about. Take you a piece of tape, lay you a piece of tape across it right here if you need to. If you're one of those people that's real nervous about it falling out and you're going to go real slow, have a piece of tape torn. And once you get in, slap you a piece of tape across the top of it. And that'll help anchor it down as well. That also gives people a better sense of autonomy. That's kind of it. Yeah, the key ring's genius, ain't it? That's good.
Jesse, can you show a little bit like how so they get to save that key ring, right? So like they'll take that off that rig, they'll use it for the next one. So can you show how you fasten it on there? I may have missed it because my internet fizzed out and I had to hop on here. So
I had it already on there. Yes, Kelly, we'll get you the Google. We're going to get you all that, Kelly, and the recording. Everybody's going to be there. Okay. It'll all be there. So with the key ring, you just slip it on, just however it'll get on the end of your rig. I just pop it on there. Just split the key ring open and just,
okay.
Yeah.
Perfect.
Yeah. Just put it on there.
That's so easy and accessible for people. You know what I mean? I mean, everybody has a key ring on their keychain, just pop that off. I love that it's taking away the fact that when you shoot, you have to use, your index and your thumb or 3 fingers or whatever. And now it's one. It's amazing.
Look at Riley. I love it, Riley. Count them up.
I know, I'm like figuring it out. I have a question if you guys don't mind answering. I don't want to monopolize time though, but can I answer?
I think we're at question and answer time, so go for it.
Well, I'm just curious, so I'm currently in Athens, Georgia. I'm not from here, but I'm here. I don't got that beautiful drawl that Jesse does. But the folks that we're essentially bringing harm reduction to an area that it has never existed in. And I'm the only one currently that has experience with IV drug use. And I get a little OCD about who it is from our exchange who is working with, essentially who's doing supplies. And I've gotten feedback from the 2 other board members that are like, dude, you got to let other people do supplies. But like in my school of thought, these exact conversations are so freaking important. And it's so important to me that we're not just giving out supplies without any education as to how to use them. And I guess my question is like, am I justified in making sure that, and it's not that it has to be me, but it has to be somebody that can have these conversations. And I do feel kind of sad because I put this link in our own volunteer squad page, hoping that volunteers who want to do supplies would jump on, and none of them did, and maybe they're just busy, whatever. But like, is it justifiable to ensure that who it is that is working with active IV users like can actually articulate this education, or is it not that big of a deal? I'd love to know your thoughts on that, both of you.
I think that it is unreasonable to expect you to personally educate every person who uses IV drugs that comes to the exchange. However, I do not think it's unreasonable at all to expect that everyone who uses IV drugs be educated by someone who can educate them properly. So, you know, that's hard, Riley, because I'm in the same place you are. Like, don't be telling my people how to do stuff if you don't know how to do stuff.
Yeah.
But at the same time, some education is better than no education, but then bad education's worse than no education. So I think the trick would be, I know what I do here is like, I've got Jasmine helping me down here. I let her educate in the areas that I know she can educate well. I have to give up. I gave up what I could to take what she couldn't. And that might be where you're at. You know, if you may have to just, or either you hold training sessions like this, like what we're doing here, you know, to train people on the basics. Is it unreasonable though? No, I mean, I would be doing the same thing.
And that's what I'm thinking. I'm thinking about creating like volunteer tracks, like volunteer positions. So like the people that do data collection can do data collection and get really good at data collection, but the ones that are doing supplies. But I think to train everybody a little bit with everything, but then expect everyone to be able to have these conversations isn't realistic. So that's just what I'm thinking about. Like, should I take 5 or 6 of them and just be like, all right, supply people, here's this training, we're doing this, like you're going to learn how to talk to folks in this way.
Yeah.
That's,
I think so.
I think-
I think so, because I mean, you're going to want to do in-services, you're going to want to have trainings, you're going to want to, and I would think, have an IV team, you know, have an IVDU team, and let that be their focus. Really drill down on them and spend a ton of time with them, really going through the idiosyncrasies of it. That's what I would do. And then, you know.
okay.
I think that's really tricky, Riley. And I think, you know, since I have lived experience, like, I think in harm reduction, we have to elevate the voices of people with lived experiences. So I think that how you're feeling is like totally valid, and like I totally hear you and hold space for you, because you don't want to be the token person that they have to go to, but you also want them to get the right information. And we also know that harm reduction is so much more than just the supplies, than just giving you needles, just giving, you know, it's about the relationships, about reducing risk and empowering people to live the life that they want to for them. And I think one thing for me, when I started, like, I did a lot of the trainings that the National Harm Reduction Coalition offers. I think it's like maybe $80 for 3 of them or something. But anybody that comes on that either wants to volunteer or that works, we usually make them go through those. And those are just basic ones that talk about like harm reduction principles, you know, set and setting, why people use drugs. They use them for all different kinds of reasons, because volunteers, they need to be definitely at least trained in trauma-informed care, especially when dealing with the folks that we deal with. It takes a very special person to do harm reduction, and you don't want to perpetuate harm by getting someone's, I'm going to say this and I'm probably going to regret saying it, but someone's retirement gig, you know, to give back to the community or whatever. And then like, they're like, well, do you want to go to treatment? You know, you have to educate. And so I think one thing that's good is the trickier ones, you know, like if people are having a hard time, then maybe they schedule a session with you, you know, and maybe it only takes one education, safer injection workshop with you for them to get the basics on it, you know. But I think that all staff and volunteers, you know, it's important for the training of like, this is what we do. It's so much more than supplies. And then the volunteers that I have that help with deliveries for like my regulars, I always say, hey, this is the drug trend. You know, when you talk to people, when you make contact with them, and I mean, we're still doing a lot of door drop off and stuff because of COVID, but, you know, I'll say, hey, if you see them, ask them how they're doing. You know, have they had any overdoses recently? Do they know anybody else that's had an overdose? Are they dealing with the sleepy dope? Any Xanax bars where they had to use Narcan because there's fentanyl in it? You know, just drug trends and overdose prevention. I think that's like the easiest thing. And pushing Narcan. Everybody loves doing Narcan because it's like the rated G of harm reduction. So, you know, that's just my 2 cents on it. But it's easy to burn yourself out when you're like, I'm the person that, you know, should be doing it, which it's like you are, but maybe it means getting more volunteers that have lived experience. You know, maybe it means bringing in participants that want to give back, that want to do a ride along with you, that want to make kits and want to teach other people how to stay safe. You know, that is an awesome way for them to get empowered and like become involved at the community level, like start a drug users union, like all good ideas to kind of keep it going. So looks like Sophie has a question.
Yeah, thanks you guys. This was really awesome. I'm wondering, I'm a nurse in Boston. I work with mostly unhoused drug users. So fortunately, a lot of the like tips are not so applicable for folks, which really sucks. But I do have a lot of people who are shooting in their necks for better or worse. I'm wondering, Jesse, if you have time to demonstrate how you teach people to do that safely. I know it's obviously riskier, but it's what's happening. So.
How to more safely go in the neck.
Yeah.
I can do that. I don't think I want to do it right here in this setting. But I've put my information in the chat, Sophie, and if you'll reach out to me, I will. I'm a registered nurse, and I was on the IV team at our hospital and the ER for 15 years. So I did go around starting external jugular veins throughout the hospital. That was what I did. So I think I'm the right person to teach that, but it's not something I'm a huge fan of teaching. But yes, I would be glad to. Yes.
Understood. But I would rather know.
Yeah. I don't advocate for it, but yes, I'll be glad to teach you how. Yes.
Thank you.
And anybody else, I mean, just you know, not right here in this meeting. I think that there's a different meeting for that, and I'll be more than glad to help y'all with that for sure.
Any other questions from anybody?
I just want to say that this was really nice and enjoyable, and I hope we do it again.
You guys are really great.
Oh, that's awesome.
Oh, thank y'all.
I'm glad you guys liked it.
I don't give compliments too often now, but y'all got it.
When I went to look you up on Facebook, Rachel King, it says popular right now for search results. So.
Oh. And I'm popular for teaching people how to shoot up right. Yes. Well, if nobody has any other questions, you know, feel free. I'm going to put my info in the chat again real quick because I think a few folks missed it.
I just put mine back in there. Oh, I'll put my phone number. We're gonna go through and here's my phone.
Are we gonna do this again? I mean, sort of.
Yes, mother. Yes, mother.
Thank you, dear.
What is my phone number? I don't even know my own phone number.
I put my work cell there. People can text or call me anytime. I also have my Facebook page for my organization. It's Phoenix Center's Phoenix 2U Project. And then on Instagram, it's Phoenix 2U. I'm also happy to talk with people privately, like if they want to talk privately, or like they need a presentation like one-on-one about going over things or about how to, any of that.
Yeah, and be sure everybody, if you want, I know I'm fixing to download the copy of the chat so that we'll have the email addresses. We're going to share a Google folder with everybody that's got a ton of handouts and things that we found. It's going to have the outline of today's thing. And as soon as the recording, the Zoom download sends to my email address, I will upload this recording into that Google folder so that everybody has access to that as well, if that will be helpful. Yep.
Woohoo! Thanks again, Jessie B. I couldn't do this without you. So grateful for your support and expertise. You're amazing. Thank you for all you do for me and the community. You're like harm reduction mama. And really grateful that we've gotten to connect like this. It's been great.
This has been amazing. So definitely y'all text and email other ideas if you've got some things that you want us to talk about. You know, and if those of you that want to get with me about like, you know, EJs and booping and all that kind of stuff, just shoot me a text, shoot me an email, whatever. And let's just really start working on this mutual aid, not only the tangible stuff, but this intangible stuff too, that can only serve to benefit people who use drugs in just the most amazing ways. And that's what it's all about. So that's it for me.
Bye, guys. Stay safe. Don't use alone.
Safe,
Carry
everybody.
Bye.